Okay, good morning, Queensland. As the Premier has already announced this morning, we have 6 new cases in Queensland. 2 of those are overseas acquired and in hotel quarantine. 4 are locally acquired in the community. However, one of those we're still checking whether this is a historic case. In relation to the other 3, the Premier did highlight these this morning. One gentleman who works at the Training Aviation Centre and another household contact has tested positive. We are putting up exposure sites, so we put exposure sites up in relation to that individual last night, but please keep checking the Queensland COVID website for any new exposure sites as we talk to the 2 household members and get more details about where they have been over the last few days. That individual has been infectious since the 23rd of September in the community, and then we have an individual who I understand works as a truck driver who has been infected since the 19th of September. I'll get the Chief Health Officer to go through these in more detail. Importantly, what does that mean as far as restrictions? What we are asking is that Brisbane City Council, Moreton Bay Regional Council, we are putting back in place immediately the mask restrictions for those 2 councils or for anyone who has been working or in those areas since the 19th of September who might live outside of those areas. So if you work in the city but you live outside of the Brisbane City Council, Moreton Bay Regional Council area, we ask you also to abide by these restrictions, which is wearing your mask at all times, indoor and outdoors, unless you are outdoors and can socially distance. This will be in place for 2 weeks while we work through the risks of these cases, and it also means in those 2 local government areas that we will be restricting access to vulnerable facilities again. So hospitals, aged care, disability facilities in those 2 LGAs will have restrictions immediately. This is obviously to protect the most vulnerable in our community. We have reached out to private pathology providers and requested in the Moreton Bay and Brisbane City Council areas to allow people to come in to get tested without appointments. So we will update on our website if we get confirmation, but I know that our private pathologists have done an amazing job throughout the pandemic in working with us whenever we do have community cases. So we do ask, if you have any symptoms whatsoever, please come and get tested straight away and isolate until you get your results. And of course, if you've been to any of those exposure sites, contacting Queensland Health and following the advice that you have been given. I also want to reiterate to everyone, vaccinations is the key. Don't wait until we have broad transmission of the virus through our communities. Now is the time to come out and get vaccinated, and we want people getting vaccinated as quickly as possible. We have now Moderna being offered in our community pharmacies. We have Pfizer being offered at our GPs and medical centres, as well as at the Queensland Health run community vaccination hubs. So, and there's AstraZeneca, of course, also at all of those sites. So there is plenty of options. There is no reason not to be getting vaccinated now. If you are 12 or older, come forward and get vaccinated as soon as possible. And I can announce that Boondall Vaccination Centre will accept walk-ins, full walk-ins, bookings not required at all from today. And it has lots of capacity, so we do encourage people, not just from the north side, but if you're looking for somewhere to get vaccinated and you're finding the other smaller hubs are really busy, come to Boondall and get vaccinated as well. The last thing before I hand over to the Chief Health Officer is the Deputy Commissioner will also update us on a very sad incident that's happened in hotel quarantine, and I'll let the Acting Deputy Commissioner speak to that. So please, we know that this virus is on our doorstep. Don't wait, go get vaccinated, and please come out and get tested if you have any symptoms whatsoever, whether you are vaccinated or not. If you have symptoms, please come forward and get tested. We do this, then we can get through this again without having to go to further restrictions. But this is a time where we need to watch very closely, and of course the hours and the next couple of days will be crucial in people coming forward and getting tested. Thank you.
Thank you, Minister. So 4 new community cases overnight. One of them is a person who recently travelled from Dili, from Timor-Leste, had 3 negative tests in hotel quarantine and then has tested positive 5 days after leaving hotel quarantine. So we're just working through whether that's late shedding or whether it is a case. So we're just working that through with that individual and her family at the moment. Now, our other 3 cases are in 2 separate, unrelated clusters. So one is a gentleman in his 30s who lives in Eatons Hill, who works for one of the aviation training sites, and he would have come into contact with overseas pilots and so forth. So we're just working through, and I should get the whole genome sequencing later today to help with that. But he, as soon as he developed symptoms, got himself tested, confirmed positive, and has now been admitted to hospital. Then we've tested the 2 household members in his own house, and one of those is tested positive, so she's now in hospital as well. The 3rd person at this stage is negative. So there are a number of exposure sites, including a childcare centre, so the Mother Duck childcare centre, so we're just working that through, and there are a few other exposure sites, so if people could please look on the website, but most importantly of all, any symptoms at all, come forward and get tested. Then the other case, the 4th locally acquired case, is a gentleman who works as a truck driver, so we're just working through with him where he might have acquired the infection. He came forward and got tested after he'd had some flu-like symptoms and has tested positive, but he was out in the community for 8 days while infectious. So we're just working that through. Now, he stayed at 3 different places, 2 hotels in Spring Hill and a boarding house in Stevens Road in South Brisbane. So we're working through with the managers of those 3 facilities as to who else was in those accommodation venues while he was there, and organising quarantine for all of those people. And we're continuing to work with him as to what other sites he's been at while infectious, but there's been a number that we've already been made aware of. That's why it's absolutely critical, please, anyone particularly in Brisbane or that Moreton Bay region, particularly that western part of Brisbane, any symptoms at all, please just come forward and get tested. That's absolutely critical. And then the other thing I need everyone to do is immediately, if you haven't got vaccinated yet, today is the day to come out and get vaccinated. We know that it takes a while to get full immunity, but even with the very first dose, you get some immunity, 2nd dose more, and then 2 weeks after that 2nd dose, you get your maximum immunity from the vaccine. So it's really, really important. We don't know where our next case is going to come from. It could come at any time, so don't wait for an outbreak. Come forward wherever you are in the state of Queensland and get vaccinated if you're 12 years of age or older. It's absolutely critical. I can't overemphasise how critical it is to just get vaccinated, and thank you to those many, many. We're well over 1.9 million Queenslanders who've had 2 doses of the vaccine. So that's fantastic. We just need all Queenslanders 12 years and over to come forward and get vaccinated. And we've got so many sites. Genuinely, there are so many places. If there's a big queue in one site, there'll be room somewhere else. So we're here today at the Brisbane Convention Centre in South Bank, but I know there's plenty of capacity at Boondall, there's plenty of capacity throughout the state. Our pharmacies are doing a fantastic job. They are ramping up so quickly with the Moderna that they've got. Our GPs also are ramping up. So there will be somewhere that can vaccinate you today, so please do that. Thank you.
Good morning. Unfortunately, today I can advise and confirm that tragically overnight a male person in his 50s was found passed away in one of our quarantine hotels. I'm not able to go into any more detail. What I will say is that matter's under investigation by police and it will be referred to the coroner following that investigation, and we're engaging with the coroner at the moment. I would like to acknowledge the response of the police, our health staff and our other agencies and hotel staff that are working at the hotel for their response to that tragic matter. Unfortunately, I can't comment any further on that.
Did you say how long he had been in hotel quarantine?
Not at this stage. It's all under investigation, and it will go to the coroner. We're engaging with the coroner at the moment. I'm not prepared to discuss any of the details on that. No, he was a local, an Australian citizen. Thank you.
What's your level of concern, I guess, for all of these cases?
I do have a reasonable level of concern. I'm also comforted by the fact that Queenslanders have done such a good job each time we've had an outbreak. I think everyone is very comfortable with masks and we know they protect. And I'm also comfortable with the amount of testing that's happening. And I know now that we've had this announcement that the amount of testing will significantly increase. So as long as we all do that we wear masks, that we maintain social distancing and we get tested, then of course we've got the added benefit. Every single day we are seeing the numbers of people who are vaccinated going up. So all of those things mean that we can try and manage an outbreak like these two new ones in a different way. But we'll be keeping a very, very close eye on what happens over the next 24, 48 hours to see if we need additional restrictions. As always, we are putting in place systems to protect the most vulnerable, so that's those people in aged care, disability care, in our hospitals and in our prisons. So we've already got that in place. Plus we've ramped up the use of PPE in our hospitals and facilities in both that Brisbane LGA and the Moreton Bay LGA. But we'll just have to see what happens over the next 48 hours.
Did you consider a lockdown at all?
Of course, I always consider a lockdown and then I work through what we need to do. At this stage, I do not think a lockdown is warranted. That could change, but I'm really very comforted by the fact that people do know how to respond and respond very, very quickly. We've seen that for the last few outbreaks.
Do you have any concerns about the NRL Grand Final on Sunday?
Not today, and we'll just see what happens over the next few days.
What might change that?
If we start to see large numbers of cases due to any of these two outbreaks that we've got now starting. The morning of the NRL.
Sorry, what
I will review this every single day and I will take the most up-to-date information.
And can I just ask, were any of these people, especially the truckie, at either River Fire or the football finals last weekend?
We've asked that question and at this stage I've been told they weren't, but also we'll just go back and confirm all of that.
And what happens to the guests at here at South Brisbane and also the two at Spring Hill?
Yes, so we're looking at the facility Adelong as a guest house at South Brisbane. We're looking at whether it might be best for those people to go into hotel quarantine because there's a lot of shared facilities, a lot of shared bathrooms, shared kitchen, a lot of shared facilities. So we're just working that through with the manager and the guests at the moment.
Is the truckie
Sorry?
Is the truckie from New South Wales?
He has been in New South Wales. We're getting that confirmed at the moment. When he was last in New South Wales, I don't have that yet.
Did you say 8 days?
Yes, he's been 8 days infectious. Remembering you're infectious before you actually get symptoms.
I would imagine it's quite a lot of exposure sites.
Yes, so that's what we're working through at the moment.
Truck drivers who travel from interstate allowed to stay in shared accommodation like this?
Yes, they can. But I just actually have to confirm whether or not he's been in New South Wales in the recent past. I don't have that confirmation yet.
And do you have any suspicions about how the guy from the aviation centre called Connor?
Oh yes, I'm sure he's got that at work. I mean, he goes to work at an aviation training centre and we know there are international pilots who attend. No.
No one or two doses.
Does the Rockley exposure side relate to the truck driver?
No, that relates to the other cases.
And do you assume that all of these cases have the Delta variant?
I've got to wait for whole genome sequencing, but it's the most likely variant because we've seen very few other variants in recent times.
With masks, do they need to be worn when sitting down at work and things like that as well?
Yes, we're going back to the setting we had prior to the current setting. So on Friday we removed mask wearing once you were seated. Prior to that you had to wear masks when seated, unless you were of course in an office by yourself. Yes.
Can I just ask, has been any thought given to drive-through vaccination clinics?
Oh, of course I've thought about it, but I feel that we don't need to do that in Queensland due to the fantastic venues we've got, such as here at the Brisbane Convention Exhibition Centre, where there's an enormous amount of parking available and it's free. So it is far safer for people to be observed sitting in a chair with nurses around them rather than sitting in a car. It's just a bit hard to observe someone when they're in their car. So given we've got fantastic venues with enormous amounts of parking, that's one of our requirements when we've been choosing our venues, I don't think we need to have drive-through. I do like drive-through for testing. Drive-through for testing is really good because it keeps everyone separate from everyone else, and we don't need to observe people after they've been tested. But for drive-through for vaccination, you've got well people. So we don't allow people who are in quarantine, for instance, to come to a vaccination centre. So they're well people, so they're fine to queue, and it's much, much safer that they're observed after they're vaccinated, seated in a seat with nursing staff very close by.
And I might just add to that, sorry, because I know that the Leader of the Opposition have been out calling for this over recent days, and I've already spoken about this before. We've been in contact with Victoria, who's doing some of the drive-through vaccinations. The number of staff and resources required to run a drive-through vaccination, they're only putting through about a third to a quarter of the number of people through drive-through. So they're not more efficient, they're very, very inefficient. The only reason you'd set up a drive-through vaccination clinic is if you have broad sweeping transmission in your community and you want to limit contact. But it is less safe because you've got to try to observe people in their vehicles. So I'd ask the opposition, David Crisafulli, to start listening to this advice when he makes these calls, because I don't want to slow down our vaccination rate to a third or a quarter of what it is now, simply because it sounds like something good to do. The facts are, it's less efficient, it's less safe, and you only do it when you've got broad submission in your transmission happening in your community.
But the men,
Sorry.
New South Wales put out yesterday has different restrictions and freedom for people who are vaccinated and who are not vaccinated. Do you see in Queensland that unvaccinated people will be given the same freedoms as those who have been vaccinated?
Well, people in Queensland, vaccinated or not, have far more freedoms than anyone in New South Wales, the ACT or Victoria. Even with the roadmaps that we have seen, none of those jurisdictions have got a point in time in the roadmaps that they've released that show them getting to the same low level of restrictions that we have in Queensland. Other than mask wearing and 1 per 2 square metres, we have very few restrictions on our entire economy. So, it really is for those jurisdictions to talk about when they think they can get to where we are now, at 64% first dose rate, versus where they think they're going to be at 80 and 90%. I hope that they can get there quicker, and I hope they can reduce their restrictions more so that people can enjoy Christmas and people can enjoy the sort of lifestyle we've got here in Queensland. But when we talk about Queensland opening up and a roadmap, we're as open as we can get other than borders, because we have got the lowest restrictions possible other than mask wearing at the moment.
Eventually we'll get to the stage, as all of you guys have said previously, where Delta will be circulating in our community. At that stage, will unvaccinated people still be able to have the same freedoms as those who are
Look, all these things are being worked through with National Cabinet, but look, we are putting in some pretty tough measures at the moment. We've got the mandatory vaccination in aged care. We've mandated vaccinations for all of the police service. We've mandated vaccinations for every health worker that steps foot in a hospital environment or aged care facilities. So, these are big moves for us to do this. But having said that, if you're a health worker now, you have to have a flu shot. There's a number of health workers who already have to have a range of immunisations to be able to work in our hospitals. So this is important to keep our health workforce safe, but also to protect every patient and every visitor that comes into those facilities. But National Cabinet will work on that. Sorry.
Just on the freight industry.
Yes.
Previously we've had discussions about the states looking at rapid testing capabilities on the borders. Is that something that's being kind of pushed forward further now that we're rolling out these vaccinations?
Yeah, look, we continue to look at all those options. We will take the advice of the Chief Health Officer on whether we take up any other type of testing. What we would want to be satisfied, though, is that the testing is accurate. So what we saw overseas is they were using some forms of rapid testing that was far less accurate. Now, why would you do that if it risks people giving a false hope that they're negative when in fact they may be a positive case, when we have an amazing testing system already in this country? So we just need to make sure that anything we move to, and of course this will, I have no doubt, be discussed AHPPC and also National Cabinet, that we can have confidence that the results people are getting are accurate and they can rely on those results.
Dr. Young, just ask about,
Sorry.
Dr. Young, just a question, just a couple more. The border bubble, is there any consideration to reinstating the border bubble given the lockdowns are ending in Byron, Lismore and Ballina tomorrow?
Once New South Wales announces changes, we then immediately review that, and when it's appropriate for us, put them in place.
And we're looking at 2 outbreaks at the moment, just to be clear.
Yes.
So, okay, so you've got the aviation worker, and then there's a household contact you're still waiting on. Is that person related to?
Yeah, so we have the aviation training worker and his wife is positive. Their child at this stage is negative, so that's one outbreak, and then the second outbreak is the truck driver.
Dr. Young, are you waiting to see updated Doherty modelling at all?
We have seen some preliminary information from Doherty, which I understand will go to National Cabinet.
And I guess, can you clarify what you need to see to make a decision around the reopening of the border?
It's really about seeing that different information. So you all saw that original Doherty modelling that looked at the 70% and 80% vaccination. Then there's further Doherty modelling that looks at those vaccination rates starting at different starting points. So it's really looking at that.
And what would your advice be to people in regional Queensland who might have tickets to the grand final and they're planning a holiday for Brisbane and they've centred their holiday plans around that?
They better get used to wearing masks when they come down to Brisbane, and they'll need to wear those masks when they go back after the grand final.
Okay, thanks guys. Thank you.
I haven't been involved in any, no.
And can I say, I'm acting sports minister. I'm not aware of any crisis talks either. So.